For most of the patients, what will bring them to hospital is because of the signs and symptoms. As I mentioned, this thyroid gland produces hormones. It produces two main hormones. It produces what we call the T3 hormone and the T4 hormones. So these hormones, when the thyroid gland is hyperactive, patients will present with symptoms of hyperthyroidism, and this is what will bring them to hospitals. Usually the patients will complain of the heart beating fast, they'll complain of increased sweating, they'll complain of feeling hungry all the time, they'll complain of weight loss, they will complain of feeling tired, they will complain of anxiety. The young ladies will complain of their periods being abnormal. So the first time they may go is to see a gynecologist because their periods have disappeared. So they are wondering what has happened, or they have become irregular. If the thyroid is underactive, then one will have symptoms. So you can see the signs and symptoms of hyperthyroidism is when the body is hyper. The heart is beating fast, you're sweating too much, you're anxious, everything about you is faster. And that's why, because of increased metabolism, you lose weight. Now, when the thyroid gland is hypoactive, now it is the opposite. You become slowed down. You gain weight. You find you're gaining weight despite eating less, despite exercising. You're not able to shed that weight. You start feeling cold, even when it is hot. You find these are people who will be wearing sweaters outside on a hot day. The other thing they will notice, also ladies, is that this time their periods may be irregular, but when they come, they are very heavy. So that will also make them go to see the doctor. They may also complain of constipation. They may also complain of dryness of the skin, and may also complain of joint pains, muscle aches. So you find that usually when a patient comes complaining of symptoms, sometimes are neither here, neither there, we usually will want to send them for a thyroid function test. They may also complain of depression. So some of the patients are diagnosed when they go to see a psychiatrist, who from the symptoms they'll ask a few extra questions and realize this depression could be due to a hypoactive thyroid gland.